Hi, and welcome to Askimo TV. We're talking today to Dr. Raj Mallipeddi. Dr. Mallipeddi is a consultant dermatologist and dermatological surgeon based in London, UK. He works both in the NHS and private sector and is head of the dermatological surgery and laser unit at St. John's Institute of Dermatology, St. Thomas's Hospital. Hi, Dr. Mallipeddi. How are you?
Good afternoon. Very well, thanks, Joanne.
Great. Dr. Mallipeddi, let's talk today about skin cancer. And let's start off with, what is skin cancer?
Skin cancer, as the name suggests, is cancer of the skin. So that's an uncontrolled growth of cells in the skin, leading to destruction of the skin tissue.
What are the symptoms that one might experience if they had skin cancer?
They vary tremendously. Sometimes there aren't any symptoms. It's just a change in either pigmentation or redness. Other signs may be bleeding, itching, a break in the skin known as ulceration. So very variable depending on the type of cancer, how long it's been there, and so on.
What are some of the causes for skin cancer?
Well, I think most people would appreciate that the most important cause is ultraviolet radiation, so sun exposure. And there has been a tremendous increase in sun exposure over recent decades, partly behavioral, as people enjoy sunny holidays, suntans become more fashionable. But there's also a depletion in the ozone layer, which provides a natural protection to us. And that's a factor in certain parts of the world. The person themselves may be at risk if they have a family history of skin cancer, if they are fair-skinned, if they have, say, a Celtic heritage, so, for example, ginger hair, blue eyes and freckles, and other health issues such as being immunocompromised. So that's somebody who may, for example, have an organ transplant and then will be on medication to suppress their immune system. And the immune system then will not be able to cope with damage in the skin as well.
Dr. Mallipeddi, how is skin cancer diagnosed and treated?
First and foremost, it's diagnosed by inspection of the skin. So that's what we call clinical diagnosis. So as dermatologists, we will look at the skin in detail and look for changes which may be peculiar to that individual. So the most common example that people will be aware of will be a change in a mole. And we will look at factors such as asymmetry, irregular border, an irregular color, a very large mole, in conjunction with some of the symptoms I've described, such as itching or bleeding. For non-melanoma, so that skin cancer not derived from moles, there may be signs such as redness or scaling. The most common skin cancer is basal cell carcinoma, and that often has a pearly appearance with small blood vessels on the surface. And the next most common skin cancer, known as squamous cell carcinoma, can just appear as a hard, indurated lump with a rough surface, although any of these may be ulcerated.
What are some of the treatment options that are available?
The treatment options vary based on the type of skin cancer and how serious it is. So if we start with the least serious, for example, a superficial basal cell carcinoma, we may treat that with creams. These creams act to stimulate the body's immune system to then cause inflammation around the lesion to then kill it off. They're typically applied every day for several weeks. Another type of non-surgical treatment is called photodynamic therapy, and this is the principle where a cream is applied onto the skin, left there for a certain period of time. So, for example, the protocol that I use is left on for 3 hours, and covered. And after the 3 hours, the cover is lifted and a special light is shone on the area at a certain distance from the skin. And there's an interaction between the cream and the light to kill off selectively the cancer cells. Moving on from that, there are simple surgical methods such as scraping and burning, again for low-risk skin cancers. And for higher-risk skin cancers, obviously there is surgery, that is, cutting out the lesion in question.
If it was a high-risk cancer, what would be the risks or side effects of treatment, and could there be any scarring after the surgery?
Yes, for higher risk skin cancers, it's very important to remove the cancer as well as a cushion or a cuff of normal skin to make sure that all the cells have been removed. There are, of course, other options for those patients who are not suitable for surgery, such as radiotherapy. And the degree of scarring will depend on, in the case of surgery, how much skin needs to be removed, and also how that wound is then closed. It may be closed just by being pulled together side to side. One may need to do a skin flap, which means cutting in a different direction to pull skin across, or a skin graft, that's taking skin from somewhere else to then patch onto the defect that's been created.
What's the prognosis for people with skin cancer?
Well, the good news is that skin cancer generally has a very good prognosis. Most of the time it's confined just to the skin, and so there is a very high chance of curing it with surgery to cut it all out. That's the most common form of treatment. There are rarer cases which may spread beyond the skin, and of course then that becomes more difficult, and the prognosis is worse. I haven't given any figures because the figures do vary so much between the different types of skin cancer and particular factors associated with those cancers. So for example, in melanoma, it will depend to a large extent on how thick the melanoma is. What I mean by that is the Breslow thickness, which is measured only when you remove it, and the pathologist can look under the microscope to see how deep it is. And these sorts of factors, in conjunction with whether it's around nerves or spread into blood vessels, all diagnosed on the pathology, will determine the prognosis.
Thank you. Thank you so much for talking to me today.
Thank you very much.